So now let's look at environmental toxins. What we do know is that people with ASD are not distributed equally in geographic locales. There are higher concentrations in certain areas and lower concentration in others. So there are many theories for this, and it's probably a little bit of many things. First, we know that there are higher concentrations where there is better availability of services. We certainly know that. Carol Gray with Social Stories and her Gray Center had attracted many people with autism to the schools where she worked. And in fact, there was a lot of complaints that Carol had to field because of that, which actually is a shame, but that's true. The other thing that is proposed is because it is a recessive gene that is responsible for autism, that the types of jobs, we see higher concentrations of people with autism in those areas that have more computer-related jobs. So that's also a theory. There's also a theory that maybe some environmental toxins that increase that genetic susceptibility to developing autism. So now let's move to chemical differences. We know that the central nervous system functioning is obviously altered in ASD, and many neurochemical studies have looked at neurotransmission in the central and the peripheral nervous systems. So what's a neurotransmitter? It's a chemical that transports signals and messages in the brain. So almost all of the neurotransmitters have been implicated, but there really are no real answers. And I think I'll reflect back just a minute. Remember that at the present, we're not studying structural and chemical and functional differences all at the same time. And I think once we can really do that, then that's going to show us a lot more information. But for right now, let's go ahead and look at the different neurotransmitters. Serotonin has certainly been implicated, probably the most consistently of all the neurotransmitters. It's responsible for sleep, mood, body temperature, appetite, and hormone release. In my time of life, I certainly have been thinking about serotonin quite a bit because I'm often quite heated, as the little picture shows. But some studies have shown that 1/3 to 1/2 of adults with autism may have elevated levels of serotonin. And also suggested is that they don't synthesize the neurotransmitter in the same way as others, but they're not really sure why that is. So all children have some elevated levels of serotonin until about age 5, but those elevated levels don't seem to decline in individuals with ASD. So most of the medication used with children with autism are focused on these neurotransmitters. So the serotonin influencing medication first is fenfluramine. It's not used as much anymore because the side effects are really not acceptable. So the negative side effects include increased irritability, and aggression, which of course we do not want in children with autism, and even more important, it's associated with some heart problems. SSRIs are widely used both within autism and without. That's Prozac, Zoloft, Luvox, Paxil, and it really reduces anxiety and has been associated with reducing obsessive compulsive issues, which are very common in children with autism, and also self-injury. We really use them quite widely, these medications quite widely with adults with autism. In fact, most of the adults I know who function well are on some SSRI as adults and say it would be difficult for them to function without them. There is an increased seizure risk in some participants, and there is an increased suicidal risk in some adolescents that needs to be monitored with SSRIs. So now let's consider dopamine. The dopamine neurons really lie mostly in the midbrain. They're associated with hyperactivity, attention differences, cognitive deficits, and stereotypies. Stereotypies are like the finger flipping or kind of motor repetitive movements. And they're also associated with the ability to plan behavior. Some individuals with ASD have higher production and higher turnover of dopamine. So now let's move to the medications that are used for dopamine. And one medication is Haldol, and it's a neuroleptic, and it decreases hyperactivity, increases attention and verbal production, but it may also increase aggressiveness and exacerbate stereotypies. And it is associated with tardive dyskinesia, which is essentially a tremor, and that tremor can become permanent. So people that take Haldol need to be checked very frequently, because if you don't notice that tardive dyskinesia is developing after 6 months, then it becomes permanent. And the test is really easy. You just have the individual stick out their tongue and you look for tremor within their tongue movements, although for some children with autism that might be a difficult test to do. Another neuroleptic is Risperdal or risperidone. It is an atypical neuroleptic, and it's typically used for symptoms of schizophrenia. However, there have been real studies looking at Risperdal in children with autism. It shows effective in reducing repetitious behaviors, self-injury, aggressiveness, and improving social awareness. This is the one medication that seems to be effective for many children with autism. It doesn't have as many side effects as Haldol. However, weight gain is a huge side effect here, and that is certainly an issue with many individuals that take this medication.